Check, check, 1, 2. All right. Good. Rolling. Should we close the door? I get nervous talking in front of people. Just kidding. I love talking. You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroRESET podcast. Okay. Hey, everybody. Welcome back to another episode of the NeuroRESET podcast. I am Dr. Teams here at Desert Brain and Spine, and my goodness, has it been a while. I think it's been a little over a month, if not maybe 5 or 6 weeks, and we do apologize for that. Here in Arizona, as you may know, it gets pretty toasty, and some of our patients tend to leave, so some of our podcast participants are off having fun and enjoying the cooler weather, typically California, West Coast, things like that, up north, things of that nature. But when we talk about that, you know, Arizona being really, really warm or overly hot, we see a lot of dysautonomia patients. Patients with POTS, you can have hyperadrenergic POTS, you can have syncopal-based POTS, you can have the neuropathic POTS. Almost every single patient that we see with dysautonomia tends to flare over the summer. Whether they're treating with us or they're communicating with us on social media. TikTokers have been huge, chatting with us as well. And everybody says the same thing. When the heat goes up, their symptoms get worse. And we totally understand that because in relation to dysautonomia, one of the hallmark symptoms is intolerance to heat. Right? So intolerance to heat, things like exercise, those types of symptoms tend to present themselves when the heat goes up, right? This summer we had over 100 days, over 100 degrees in a row. So I do not blame anybody for leaving town. But what I will say is now that it's cooling off, usually October through about April are the best times for people to come into town and work with us through our intensive model. And so the outside of the summer is the best time to come in for treatment, although people do still do well when they come in for the rehabilitation aspect. We send them home back to their better weather, and they tend to do better once they get home as opposed to having all their gains here. And so there's two things I really want to talk about today in regards to symptoms and dysautonomia and really understanding how hard you need to push, right? So here in the office, we have a rule of thumb that we follow. It's called the 80% rule. And what that means is, let's say as an example, we give you an exercise and we call for 3 sets of 15 repetitions. Well, if we get to 2 sets of 10 repetitions, we're going to look to maybe even back that off to like 1 set of 10 to 15 reps because the total volume tends to be too much for that person's brain or nervous system to handle. At the same time, we find that people, and actually I just had a conversation with this patient earlier this week, and she's going to be a guest on the podcast here shortly in the next couple, maybe few weeks to a month or so. And she's been dealing with dysautonomia for a long time. Former, almost professional level dancer. And, you know, there's a lot that comes along with being at that level of competition as well as that industry. And so I will let her tell you all about that. But at the same time, you know, every single person that feels like crap most of the time, anytime they feel good or have a better day, they want to go and do all the things that they used to do. Unfortunately, the nervous system isn't in a place of tolerance just yet. So most of those folks that have the good day, they get out there and put themselves out there like it's a normal day, and they crash the next day or even go through a multiple day or week-long crash because they used up tomorrow's energy today. And talking with this individual, she's like, yes, I just did that 4 days ago and I'm still in this flare. And I knew that I did it, but I just wanted to go out and feel normal. I'm all about doing that, but really following that 80% rule has a much better long-term outcome so that we're not taking 2 steps forward, 2 steps back. We're consistently taking like half a step forward so that by the end of the treatment program or by the end of like a 3 to 6 month time of working together, you're significantly farther than you could have been as well as you're significantly reducing the amount or the size of these flares that people usually call them, right? And so every one of our patients that come in that has dysautonomia specifically, particularly more the POTS patients, whether it's the syncopal or the hyperadrenergic presentation, understanding that the days that you feel good, you really do not want to push too hard. And that is probably the number one thing that we coach most of our, if not all of our patients on, is that 80% rule. Now, when we're out in TikTok land and we're giving basic recommendations, like recently I released something about, re-engaging with heat to help improve your tolerance to heat, right? I understand, and we completely know and understand that doing that by itself when you have no other help is not the best thing to do. And that gets misconstrued out there, meaning that if we say something, everybody takes it as this is a medical recommendation. It's not, right? Because every patient's a little bit different and everybody's tolerance is in a different place than it was even yesterday, right? So in regards to the heat of the summer that we were talking about and giving information out on, say, social media, we have to be very careful what we do say. And certainly that heat tolerance or heat exposure, people didn't hear that or they took it at face value, and that's okay. That was our mistake. What I do want to say about that is anybody that we start engaging with heat exposure, quote unquote, therapy, they've already gone through an entire neurological program. They've already shown improvement on testing and in symptoms and in heart rate variability and lowering their heart rate and improving their tolerance to getting back to work or to driving or to just walking to the mailbox. Cognitive types of performance measures. We only ask people to do things that we feel that they can handle because we understand how bad these crashes can be. It's interesting because concussions actually look very similar to dysautonomia and POTS. So did you know that every concussion develops POTS, not necessarily POTS, but dysautonomia in the beginning aspect because the brain, it becomes damaged in the short term. Really, those connections become faulty. Not necessarily that the nerves don't die or they're not necessarily killed off in, say, a concussive situation, but the integration or the communication between those nerves breaks. And that happens not only in the cortex for, say, like cognitive or the vestibular area for, say, dizziness, vestibular symptoms, but in the brainstem where the vestibular system lives is also where the autonomic system lives, right? And so as we kind of peel back these layers, we go cortex or the frontal lobe fires to really modulate the function of the brainstem to essentially activate the rest and digest side of things. So if that's not happening, right, if the frontal lobe's not doing its thing in a concussive situation, you're going to develop either more of a fight or flight response or such a discrepancy between your fight or flight and rest and digest and instability that you're going to develop dysautonomia. And so more recently, when you look at the Dysautonomia International Symposium that went on over the summer, these medical doctors, cardiologists, they're all describing concussive symptoms. Every single patient that sustains a concussion is going to develop dysautonomia symptoms. Now, ideally, those are going to heal within about 30 days for adults and 4 to 6 weeks for adolescents, so say high school and younger. And so we can get into treatment in that time frame to start to dampen the inflammatory response, which is what we do with laser, and it's probably the best way to do that. is to start decreasing that inflammatory response, right? We want that response to happen so that it cleans up the debris from the injury, but we also want that inflammatory cascade to end at that 4 to 6 week mark. So, so what we do in situations with an acute concussion, people will come in and they'll just start the laser in our passive recovery program. So we use laser, PEMF, vagal nerve stim, and red light therapy to basically calm the nervous system down, activate the vagal response, and keep that inflammatory response from getting too big, okay? Going back to the dysautonomia side of things, we have to start everybody lying down so that they can get blood to their brain more effectively. And so, so bringing that all back around to the dysautonomia and the heat, now that it's cooling off in Arizona, we would be more than happy to have these discussions about people flying in and really working with us on these intensive models. You know, there's a very few amount of clinics in the country that really truly understand the pathways and the autonomic regulation of dysautonomia, so that when somebody presents, every single case that comes in is different. There's a similar approach, but everybody's treatment is a little bit different, okay? So what we do for our intensive model in these cases is, one, we have a consultation. Right now we're doing free consultations, at least for the next couple of months, because we're finding that so many people have been burned by so many different doctors, practitioners, programs, whatever you have it, that we want to give people free access to help them understand that we know what we're doing. At the same time, it gives us an understanding of really how far down the road or down the rabbit hole somebody is, right? If somebody shows up with 10% function and we expect them to, be back to normal, I think that's an unfair expectation for both the patient and for us in like a short 3 to 4 week time frame. And so what we're doing with any dysautonomia case is right now we're doing a minimum of 3 weeks. So what each each week looks like is we start low and slow, and whatever you can handle is what we're going to treat for. Our goal is to get to 3 to 4 visits a day. Some people only get 2 to 3, and that's okay. We just need to understand how to navigate your case, and that most of that happens on that initial consultation. Once you arrive in the office, we do our evaluation, and that really helps us determine exactly what we need to do for the rehabilitative phase. While we have an outline of how we progress through things, everybody needs something a little bit different to get them to each next level as we progress throughout each week. The less functional, right, so 10 to 25% function, those individuals are usually going to be there for closer to 4 weeks. Individuals from like, say, 30 to 50, 60% are usually going to be 3 weeks. Anything above 60, 70% is usually a 1 to 2 week intensive. And so that's just what we found over the last couple of years of doing these intensives with really complex cases. In those intensives, we go through the neurological rehabilitation, we go through the breathing mechanisms, we go through any psychological low-hanging fruits, right? Like if somebody's doing negative self-talk, we teach them how to do positive self-talk, right? If there are major stressors in their lives, we have to really discuss those to make sure they're not overly affecting and causing reactions in the system, right? We're working with someone right now who knows that their psychological system responds or reacts very quickly and intensely to any small stressor. And so as part of their program, we have to really work with those parts of the brain that control the reactions, which really comes back to the frontal lobe and the amygdala. So every case that we work with, we work very individualized and a customized approach. At the same time, we like to progress people through on a specific timeline if we can, because we know we're reaching our milestones of improvement at the same rates that we are expecting. And so I just wanted to throw that stuff out there. One, welcome you guys back and apologize for being gone for so long. Two, touch base on the heat thing because of the summer and really understand that when we talk about heat exposure, you really should have already gone through an entire rehabilitative program to get to that next step because heat is so intense for so many dysautonomia and POTS patients. The third thing is talking about our concussive cases who all go through some form of dysautonomia in the first 4 to 6 weeks, and hopefully that heals up. And if it doesn't, we can help you out with that. And then lastly, we wanted to touch base on our intensive model that has really shown to make serious improvements in so many cases, from concussion cases to dysautonomia cases to POTS cases to tremors to functional neurological disorders. All of those things do extremely well in that 3-week model of intensity or of the intensive model. So if you guys have any questions or you want to connect with us for a free consultation, please give the office a call at 480-674-9199. And one of our amazing staff will walk you through the process of how to really set up that appointment and really have the conversation with one of the doctors here in the office. Or you can reach out online. You can start texting with our office directly through our Contact Us page. And then obviously we're all over TikTok, Instagram, Facebook, and YouTube. So if you guys have any other questions, ask it there. And anything pertaining specifically to your case, we'll have to have a consultation and establish you as a patient. So outside of that, I just wanted to say, hey, I'm really excited to get back on these podcasts. We got a lot of cool stuff coming up for you. We're going to have interviews with the staff. We're going to have interviews with more doctors and vendors, and also patient testimonials as they come through the office and they experience the results that functional neurology can provide for all these conditions we've been talking about. So thank you so much for listening, and we will catch you guys next time. And this is the NeuroRESET podcast. We'll see you next time.